This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Back to the short hair. Took a break. Now we're back. Yvette has shorter hair.
Yeah.
Less makeup. For sure. Just perking up those cheeks. Okay.
All right.
Speaking of cheeks.
Cheeks.
Not really.
No, I was like, ew, don't tell me that it has something to do with cheeks. I didn't see that when I was looking this up, but, you know, maybe I missed something. I'm not sure. Anyway, so as you guys have probably seen in the news, because I have, and that's why we decided to bring this topic up now, syphilis is everywhere, apparently.
Yeah, it's disgusting.
It's gross. Like, all of a sudden, because it was very rare just a couple of years ago. So it wasn't like a very talked about thing that people were getting still and whatever.
I think it was called the clap.
I thought that was chlamydia.
Was it? It could be chlamydia.
I thought it was chlamydia.
The clap. Gonorrhea. Okay.
Oh, gonorrhea. Never mind.
Never mind.
Anyways. Yeah. And then all of a sudden, it's made this massive resurgence that it's become like a public health concern and all that stuff.
And penicillin is in a shortage, which is how you treat it. So not a good time. Not a good time for a syphilis surge, for sure.
Yeah. So we're going to talk a bit about it, educate anybody that wants to be educated on it a little bit, what it is, how do you treat it, what to look for, all those things. So what is it?
All right. Syphilis. Just sounds nasty.
It does, right?
So syphilis is a sexually transmitted bacterial infection caused by the bacterium Treponema pallidum. So it's characterized by stages, each presenting different symptoms. So we got the primary stage, which is a painless sore on the genital area, rectum. It could be in the mouth. It could be a large lymph node near the groin. Julie's disgusted already. Your face.
I can't. Like, I didn't even realize I was doing it.
Have you seen pictures?
No.
Oh, God.
No, I actively avoided it. I saw like
talk about syphilis and not see pictures.
I saw like diagrams, like illustrations, not actual pictures.
Yeah.
It's just,
So then you got this. Oh, well, let me tell you, every medical person out there that has studied STDs or has had it like on board exams knows what I'm talking about. There's like this particular picture of syphilis in like babies, like congenital syphilis.
Oh.
It looks nasty. But anyways, okay, so secondary stage is a rash of fever, swollen lymph glands, weight loss, hair loss, headaches, and muscle aches. And then you can have the latent stage, which is no symptoms, but the infection is still present. That's why it's called latent. And then the tertiary stage is when that's the most severe. So severe health issues like organ damage, neurological problems, and even death if it's left untreated.
Right.
So do you know that syphilis, like what kind of organism it is?
Bacteria, right?
Yeah, a spirochete. Because it's a little spiral.
Right. Oh, I remember that now
Yeah.
from microbiome.
Yeah. Nasty.
Yeah, gross.
Nasty motherfucker.
Ugh.
All right. So, Jules, how's it transmitted?
Well, like she briefly touched upon, it's transmitted primarily through contact with the syphilitic sore, known as a canker. These sores,
Yummy.
all of this is going to be gross, but it is what it is. These sores can occur on or around the genitals, anus, rectum, lips, or mouth. The infection can be spread during vaginal,
Lord.
vaginal, anal, or oral sex. Additionally, a pregnant person with syphilis can transmit the infection to their unborn child. It's important to note that syphilis cannot be contracted through casual contact with objects like toilet seats, doorknobs, or shared clothing. So calm the hell down, Karens.
No, and I cannot tell you how many times me like as a medical student and even as a resident, I had to do, it's kind of crazy, but when you're a resident, they have us do this rotation where I had to sit in the car. So we rotate through the Department of Health.
Okay.
And then you know that it's like reportable, it's a reportable disease.
Yeah.
So they literally have a person that their job is like a field agent, okay? And then they go and track down the person that has syphilis, okay,
Jesus.
to make sure that they come back in for testing and answer every single person that they've been in contact with so that they can get in contact with them. And when I tell, so I'm a little like resident sitting in the seat of this Jeep, right, with this agent, and she's telling me the craziest STD stories that she's ever heard in her life, which are insane.
Those stories have to be like the juiciest.
The juiciest. She's an agent, okay?
Oh my God.
So she has like telling me like crazy, juicy STI stories. And I'm over here and we're literally like, all right, well, I'm going to park down the street because if they see me, then this is always like, this is a very risky job. And I'm like, wait a minute. I'm like, what's going to happen here? What's going on? And then she's like, no, yeah, you know, sometimes like they can get aggressive because they know that they're tracking them down and they don't pick up the phone calls and stuff. So they show up to the house. Like they will go to your house and find you.
But to do what? Like other than reporting you? Like just they don't want to be reported. So
no, they need to interview you so that they can see who you've had sex with so that they can tell the other people to go get tested.
So okay, I'm trying to get here at like, why are you running away from this person? What's the big deal? But it's so they don't go tell the other person that you have it, that you got it from them.
Wait, what? Wait, what?
I'm thinking like, why is a person like the patient running away from this agent? What's so problematic about it?
No, because they're avoiding them having to be interviewed. They don't want to tell other people that they have syphilis. Exactly.
Yeah, they don't want to tell whoever the hell they had sex with, and you know all that. Okay,
Yeah.
I get it now. I'm like, Jesus, like why?
Yeah. And then I was
the
like,
persecution.
and she was trying to tell me, she's like, no, like these stories can get crazy. She says that once she had a patient that had syphilis and they were tracking him down for such a long time. And when they finally tracked him down, he ended up admitting that he went to this like kind of party.
Oh no.
And then hold on a second. And then I'm like thinking it's just like, you know, a regular party.
It's like a fucking orgy.
Yeah, so an orgy, right? No, girl. An orgy is nothing.
What?
It was a motel, okay? And apparently this motel had night parties where people would go from room to room to room to room to room in the motel. So that's how he got in. He had to report everyone there to go get tested.
Okay. I don't want to kink shame anyone here or none of that. Like, but
no, girl, listen. Everyone has their vices, but yep.
Oh.
Yep, from room to room to room to room to room. They literally just bounce, and it's like, you know, like parties. Like apparently it's like a thing. And it has a name. I just can't remember the name that she used. But anyways, yeah. So here I am, like hunting down people, and I'm literally thinking, I'm like, what am I doing? Like, I'm like, what? I'm not gonna do this for the rest of my life. Like, I'm not gonna be hunting down people. Like, I'm not that person. I am the person that tells you, hey, you should tell your partners. You know what I mean?
Yeah.
And that's it.
No, that's about it.
You know?
Yeah.
That's as far as I'm gonna go. But you know, I feel bad. These agents like go to houses, knock on doors, okay, and then they're like, oh well, this person isn't here. They're in this place. So then they go to that other place to. Yeah, it was crazy.
Oh my God, I did not know such a thing existed like that. At least of it being that hardcore.
Yeah,
I'm sure that. You know,
I thought it was just phone calls and letters. No, girl, there's a field agent that goes out and bangs on your door.
Oh my God! Like
and then they're like, if there's like another person, let's say a person's like mother or something like that, they're like, oh well, who are you? And they're like, well, we can't tell you, but we're looking for your son, and could you just give him our card? We're from the Florida Department of Health. Or whatever. So then the other person gets freaked out, and it's like this whole entire drama.
Jeez, it's like the 007 of STIs here. Like what? Oh my God, that's ridiculous. That's a hell of a job. It's like social working.
Yeah.
Those type of jobs. Oh boy.
Yeah.
Oh boy.
So now we're going to go into a little bit more of the details and the symptoms. So if you have any of the symptoms, please, for the love of God, go get tested. Especially if you live in New York.
I know.
All right, so the symptoms of syphilis can vary as the disease progresses through different stages. So primary stage, so you got the small, painless sores on the skin, potentially inside the rectum or the vagina, enlarged lymph nodes near the groin as well. The secondary stage, you're going to have rash with small reddish-brown sores, the sores in the mouth, vagina or anus, the fevers, swollen lymph glands, of course, and then you'll also have some weight loss. Some people complain of hair loss. headaches, muscle aches, extreme fatigue. Then you have the latent stage, which we said is kind of like the dormant stage where you don't have any symptoms, and it can just be like that for many years, but the infection is still there, so you can transmit it. Okay.
Wow. That's so scary.
Super. Yeah. I'm literally, as I'm I'm thinking about all the stories that lady had told me.
Lord.
And then you have the tertiary stage, and this one is permanent organ damage. So you'll have neurological problems. You can have a stroke, you can have numbness, you can have dementia, you can have heart issues, you can have visual issues or blindness. You can even have, like with your dementia, you can have personality changes. So these are all symptoms of tertiary syphilis. So if you have any of this, it's important that you seek some medical attention if you suspect that you've been exposed to syphilis and having these symptoms. And really early diagnosis can be treated, okay? And it's crucial, okay? The incubation period for syphilis, which is the time between exposure to the infection starting to actually have symptoms, typically ranges from 10 to 90 days on average being 21 days. So that's a long time.
Yeah. Yeah.
Can you imagine having to contact that person from 3 months ago?
Some people don't even remember at that point. Like, you know, depending on however your life is, you know.
Yeah.
Lord.
Going to those motel parties. Lord.
I'm like slightly traumatized with that. Oh, God. Jesus Christ.
So important to note that symptoms may not manifest in some people for an extended period of time, even though they're infected. So consistent testing and prompt treatment are essential for effective control of syphilis. So go get tested.
Yeah, for the love of God, get tested. Anyway, so pregnancy with syphilis, it's a big one, and it's one that's come up in the news a lot, especially in bigger metropolitan cities like New York, especially New York, this is a concern. We're seeing a lot of babies now, unfortunately, being born with what would it be called? Congenital syphilis,
Congenital,
right?
yeah, congenital
So
syphilis.
if syphilis is not treated during pregnancy, it can have serious consequences on the unborn baby. According to health professionals and the CDC, untreated syphilis can lead to miscarriage or stillbirth, the baby's death shortly after birth, congenital syphilis, which can cause bone damage, severe anemia, enlarged liver and spleen, jaundice, nerve problems causing blindness or deafness, meningitis, or skin rashes. It's crucial for pregnant women diagnosed with syphilis to receive immediate treatment, typically with a penicillin regimen. The treatment is most effective when initiated at least 30 days before delivery. Infants exposed to syphilis should be thoroughly evaluated at birth and closely followed post-delivery, as symptoms may develop later if not treated appropriately. For more detailed information, you can refer to the resources provided by your health professionals and the CDC on this topic, which of course I will have in the show notes as well. Scary stuff.
I know.
Very scary, very serious for those babies.
Yeah, it's terrible.
It's horrible.
And for all my PD people out there that know the diagnosis of syphilis, it is so annoying to follow the flow of diagnosis of syphilis, the questions. So, okay, so funny story as a resident, because I have a lot of these, okay? So I'm a senior resident, and I'm on my newborn rotation, right? So this is like a very happy moment for a lot of people, a lot of couples. So, no shame to my OB people, okay? But there was so many times that the OB people would not tell the mom, okay, that she had syphilis because it was diagnosed at the hospital, right? So
What?
like they would test the mom like at the hospital. And then so by the time that I got that testing, baby's born, I have to get the ball rolling with diagnosis and evaluation for the baby.
Right.
So there were multiple times that they would just be like, oh, well, the pediatrician's going to talk to them because of the baby. And they're like, so they're going to like break it to them, right? Many times this happened.
Oh my God, that's so annoying.
Very. So then a lot of the excuse would be like, well, no, because we tested them before and, you know, during their first trimester and everything was negative. And then I'm like, but have you seen the new ones now?
Yeah, yeah.
And that's why when we test, it has to be within a certain time window because you can become infected again. So, or not infected again, but you can have an exposure, obviously.
Right.
So I go into the room on these parents, right? And the mom comes back positive on her RPR, which is one of the tests, the blood tests that we do to to screen for syphilis. And so I go into the room and I am fully expecting that she is aware of this.
Yeah.
Right.
Yeah.
So I come into the room and then I'm like, hi, I'm Dr. Gonzalez. I'm the pediatric resident and I wanted to talk to you about some of your blood work. And then the lady's kind of confused, right? And here I am, like just coming down, like smashing in on their happiest moment of life with their first child. And I always ask the mom, right? And I'm like, is it okay that I talk about your medical history in front of your person, right?
Yeah. Whoever's right.
And the mom's like, yeah. I don't have anything to hide. And then I was like, great. So I say, I'm like, your RP, I'm very selective with my words, right? So I'm like, your RPR, okay, which is that test. I'm like, your RPR is reactive. Okay. And then she's like, what does that mean?
Yeah.
And then so I'm like, well, an RPR is what we use to screen for syphilis.
Oh, Lord.
And then she just looks at me with a blank face and she's like, syphilis. And then she's like, what is that? And
No.
I'm like,
No.
so I'm there, and in my mind, mind you, I'm in front of them, so I have to do all this in my brain and make sure that I'm not, like, it's a sensitive subject.
Yeah.
So then I'm like,
no. Oh,
so
no.
I was like, syphilis is a sexually transmitted disease.
Oh.
So they just both blankly stared at me. And then I'm like, did your OB not discuss these results with you? And then the mom's like, no, but I'm really confused. Like, what do you mean it's a sexually transmitted disease? And I'm like, it is contracted through sex.
Yeah, like.
Yeah, exactly. I'm like, there's some like sexually transmitted disease.
How else do you want me to say this?
And so they both look at each other. Okay. And then they look back at me. And then they're like, so you're trying to tell us that I have syphilis. And then I was like, I'm not saying that you have syphilis. I'm like, but the computer says you have syphilis. The results showed positive.
The test says you have syphilis. Not me. I'm just reading it for you.
And then they're both pissed off. And then so I tell him, I'm like, we need to do the confirmatory testing for you, right?
Oh boy.
And then and I'm like, so then she's like, but what does this mean for baby? So then I say the whole entire thing for the baby. And I try not to be crazy informative because what happens is the confirmatory testing is negative, which could be a false positive. So then I'm like, like, I don't want their heads to be like crazy, like going down this like route. And then like literally in the middle of the conversation, the mom's like, have you been unfaithful? And all these things. And I'm just like, oh my God. So then I'm like 2 feet away examining the baby. And the mom is like having this like bickering fight with the husband. And then the husband's like, you know me very well, like Walter. And so it's all these things. And I'm literally like, I'm like, oh my God, oh my God, oh my God, oh my God, oh my God. I'm like, this baby's perfectly fine. Like, there's no congenital syphilis here.
Oh my God, thank God.
And then, but again, like, it's just my physical exam.
Yeah.
So I'm like, I really need to get out of this room right now. So I turn around, I'm like, baby looks great. So we're going to wait on that confirmatory testing. Okay.
Yeah.
And then I like bolted out of the room and I was like, my God, I just shat on probably one of the happiest days of their lives.
No.
And I came in and I shat all over it.
Damn it. Why the... Okay, that's not fair.
It ended up being negative. Yeah, like, so she did not have syphilis. The computer said she did not have syphilis.
Oh my God. You literally just shit.
I shat on that day for them for no reason. But I wanted... Mind you, I was there for the baby, not for her.
Oh my God.
Because they were like, well, why do you need to test the baby?
I almost feel like it would have been better for them to have had it. Like, to be positive at this point after everything. You've been unfaithful. No, you know me. Oh my God.
I'm pretty sure I walked in after and I was like, well, that wasn't, it's a good thing that came back negative. They wanted to like throw everything at me. Mind you, it's like not my fault, right?
No, I know it's not your fault, but like, holy shit.
I hate that shit. And I remember calling the OBs and I was pissed off.
Hell yeah.
Pissed off. And then I was like, I'm like, you need to talk to your patients.
I mean, that's their specialty.
Yeah.
You know?
I'm like, I told them, I'm like, I should be able to come into the room.
Yeah.
And just be like, hey.
Baby.
Yeah, baby. Like, I need to make sure baby's okay because of this in your history. You know what I mean?
Exactly.
Yeah.
Yeah, that's not
my job.
Yeah. Oh, boy.
Girl. All right. So syphilis, we're going to go back to the diagnosis of syphilis. So how is syphilis diagnosed? Okay. So one, physical exam. All right. A healthcare provider is going to examine any rashes or any sores and see if it's kind of, looking like syphilis. All right. And then blood tests. So these can detect antibodies that the immune system produces in response to the infection. So the antibodies in the bacterium that cause syphilis remain in the body for years. So the test can identify both current and past infections. So the way that we do that is that we go ahead and we measure what's called titers. Mm-hmm. So if you have a positive RPR, we're gonna reflex that to measure your titers, right? So if you have like 1-to-1 titers, then that means that you probably have an old infection on a new infection. But if you have a ratio that's, I think, doubled, I literally have to look at the algorithm every single time. But basically, if you have a change in that ratio, then that is suspicion for a new infection.
Okay.
So fluid from sores. So laboratory analysis of the fluid from syphilitic sores can actually confirm the presence of syphilis-causing bacterium. And then you sometimes, if you do suspect that a person has like tertiary disease, so neurological syphilis, then you can do a spinal tap or a lumbar puncture. So it's basically when you just get a little bit of the spinal fluid, the fluid that surrounds your whole entire spinal cord and your brain. And then if there's any neurological symptoms, you're going to take a sample of that cerebrospinal fluid, CSF is what we call it, and then we check that to see if there's any syphilis in that. So then after the diagnosis, after the doctor shits on you, okay, it's important to notify any sexual partners to have them tested and treated if necessary to prevent the spread of the disease.
Or leave it to the agent that's going to...
Oh, yeah, or leave it to the agent that's going to hound you down for sure. No, they'll come knocking on your door for sure.
Oh, my God. Wow. Anyway, so treatment. The treatment for syphilis typically involved antibiotics, which now, unfortunately, we're on a shortage of penicillin. So I don't know, maybe that has to do with like why there's like an uproar of syphilis. Not uproar, but an uptick, I guess, of syphilis. I don't know. But anyways, so typically involved with antibiotics with the preferred choice of being penicillin. So a summary of treatment guidelines. Early stages. A single injection of long-acting benzathine. Penicillin G is usually sufficient to cure primary, secondary, or even early latent syphilis. Late stages. For latent syphilis or syphilis of unknown duration, the CDC recommends... Me cago en la mierda.
What's it?
That's my mother.
Oh, why does she beep?
Because she's here and she likes to be Cuban and beep and cause that. Yeah. Okay, great. So the CDC recommends 3 doses of benzathine. Yeah. Benzathine, penicillin G administered at weekly intervals. Penicillin allergy. For those that are allergic to penicillin, desensitization. I'm like paying attention to my dogs that don't stop barking in the background. And I couldn't say that word. Anyway,
desensitization.
Procedures may be recommended, or alternative antibiotics like doxycycline, ceftriaxone.
Oh my God. Ceftriaxone. Joel. Ceftriaxone.
Or azithromycin might be used. And I know azithromycin because I'm not great with penicillin.
I just love your Spanish accent. Azithromycin.
Azithromycin.
Yeah. Azithromycin.
Yeah. All right. So it might be used if you're like me and you don't do well with penicillin. Like I sometimes get hives. So then that's why.
Yeah. Apparently I'm allergic to penicillin.
Oh, you too? Okay.
Yeah.
All right.
I don't believe it, but
I think
I have to actually go and get that allergy evaluated because penicillin's important.
I know. Anyway. So it's important to follow up with regular blood tests and exams after treatment to ensure that the infection is cured. So additionally, sexual partners should be notified and tested, and sexual activity should be avoid it until sores are completely healed and you're completely treated and free from it. So yeah, go ahead.
All right. So what happens if you don't treat it and you got long-term symptoms? So untreated syphilis can lead to severe long-term health issues. Here's what could happen. So neurosyphilis, can occur years after the initial infection, affecting the brain, spinal cord, potentially causing dementia, meningitis, seizures, hallucinations. You can have heart problems, so cardiovascular disease, damage to the heart and the blood vessels may occur, including aortitis and aortic aneurysms. That's kind of like the hallmark of syphilis, cardiovascular syphilis. And then ocular syphilis, this can result in vision problems, including blindness. You can have hearing loss, okay, that affects to hearing problems in both your ears. You can also have gummatous syphilis. It's disgusting. I just remember the gummas, okay? This is a formation of gummas, okay, which are soft tumor-like growths that can appear on the skin or internal organs. Gummas. Disgusting, okay? Ugh. So congenital syphilis, if passed from mother to child during pregnancy, it can cause serious health problems in the infant, and there's a lot of things that can happen. So problems with the bones, just a lot of things that can happen. And then increased risk for HIV. So individuals with syphilis, sores have an increased risk of acquiring an HIV infection, okay? And then it's important to note that these complications can develop over many, many years, okay, and may not be reversible. So even if you're treated, right? So you need to make sure that you're tested on time and treated on time.
Don't let it
because
progress.
these things can be permanent. So therefore, an early diagnosis and treatment is crucial.
Oof. All right. So the prevalence, how common is this? Apparently right now we're having an uptick. So we're going to talk a little bit about that. So the current prevalence of syphilis in the United States has been on a concerning upward trend, as the latest data from 2022 reported syphilis cases have increased by 80% since 2018, with more than 207,000 cases. This rise in cases is the highest number reported since the 50s.
Terrible.
In terms of latest news, there are several critical issues being reported. There's a shortage of the only drug that treats syphilis during pregnancy, which is leading to untreated cases that can pass to newborns, potentially causing death or disabilities. The U.S. was previously on a path to eliminate syphilis, but now the disease is surging, particularly affecting pregnant individuals and babies. Public health leaders have expressed concern over the difficulty in assessing, screening, and testing, which is contributing to the resurgence of syphilis. The U.S. Department of Health and Human Services, HHS, has announced actions to address the syphilis epidemic, including the establishment of the National Syphilis and Congenital Syphilis Syndemic, NSCSS, Federal Task Force to reduce rates and promote health equity. The prevalence of syphilis varies globally. According to WHO in 2020, an estimated 7.1 million adults aged 15 to 49 acquired syphilis worldwide. It is important to note that men, particularly gay, bisexual, or other men who have sex with men, account for the majority of these cases. For the most current statistics and information, you can refer to the CDC and WHO websites, which I will link, of course, as I've said.
Yep.
So yeah, how do you protect yourself, Doc?
All right. So protecting yourself from syphilis involves several precautionary measures. So obviously use protection. So condoms or dental dams. I fucking can't stand dental dams. Or, well, not like, just the idea of it. Do you know what a dental dam is?
I don't think so. I don't think I've ever seen one in person either. So hot right now.
Yeah. It's like literally.
What the fuck?
Mm-hmm.
I mean, at that point, just don't do it.
Mm-hmm. Yep. So.
Oh boy.
All right. So it's like basically like a female condom or whatever. Okay. Well, there's actually female condoms. But anyways,
Yeah.
all right. So just use protection. Okay.
Yeah.
So employ condoms for vaginal, anal, or oral sex, and then dental dams for oral sex to reduce the risk of transmission. So regular testing. Get regular screening for syphilis, especially if you have multiple sexual partners or engage in unprotected sex. Limit the sexual partners. Okay. So reducing the number of sexual partners can obviously decrease the risk of STI transmission. Why? Because if you stop having sex, then you stop risking getting an STI.
Yeah.
there is a direct correlation there. So avoid sharing needles. Never share needles, as syphilis can be transmitted through infected blood as well. Treatment for partners. So if you're diagnosed with syphilis, ensure that your sexual partner gets tested and treated to prevent reinfection. So abstain from sex with infected individuals and then avoid sexual contact with someone known to have an active syphilis infection. So remember to communicate with your partners about STIs and sexual health. It's also crucial. So if you suspect you might have syphilis, seek medical attention promptly, and so that you can get diagnosis and treatment early on. So also just one thing that I want to throw in there, it's like highly, highly, highly important for medical professionals to not be afraid or assume that no one is having sex. Okay?
Yeah.
There has been many times, me as a pediatrician, that I have treated syphilis in teens.
Wow.
Many times.
Wow.
Yes. And there's times where sometimes they just do a questionnaire or something like that. And then they just say no to the questionnaire. And then I always interview my teams like by themselves.
Right.
And I'm like, hey, like everything is between you and I. Like, are you sure? None of this, like you've never had anything. And I cannot tell you countless times where I've had patients like just not even, they can't even verbally say it. They just like point and they're like, oh, well, I think a person that I've had sex with had this, and it's been syphilis, it's been chlamydia, gonorrhea.
Yeah.
So,
Oh boy.
yep. So
They're probably scared of it too. Like they're scared of
they're scared. No, they
everything.
don't understand it.
Yeah.
They truly don't understand it. So.
Right. And then they're like, oh my God, if my parents find out or whatever, like that's probably the first thing that's going through their minds, you know? Oh man. Anyway, so there have been cases of plenty of famous people with it. And we're going to go through like way back to current. So Christopher Columbus. I heard this. I heard this and I'm like, what?
How do they even know?
Well, some evidence suggests that Christopher Columbus's crew may have contracted syphilis in the New World and brought it back to Europe.
Awesome. Thanks.
Isn't that wonderful?
Them.
Yeah. What are you going to do? Then Elizabeth I, who reigned England's most prosperous times, apparently she was trying to hide the like sores and stuff like that. Yeah. Then the more recent, more very, very commonly well-known, there was even like a recent movie that showed, all of this happening to him, was Al Capone, which he contracted syphilis probably in his youth. The disease went untreated for years. Capone's syphilis progressed to neurosyphilis, affecting his brain and leading to mental deterioration. Yeah.
Deterioration.
Okay. While imprisoned at Alcatraz in the early 1930s, Capone began to show symptoms of his deterioration. I can't say the freaking word. Okay. His condition worsened after his transfer to Alcatraz, where he spent his final years in a state of confusion and decline. After his release, he lived a reclusive life in Florida, his mental faculties severely impaired. Capone eventually died of cardiac arrest after suffering a stroke, which is a complication of advanced syphilitic condition. So, yeah, guys, syphilis is no joke. It's not something that's like, oh, well,
Yeah.
yeah. Because the scary thing about it is how sneaky it could be. Like, you may not have any symptoms, and then all of a sudden, you have them, So, get tested. I mean, if you're going to go to the doctor anyway, you're having unprotected sex, whatever, just get the blood test, you know? It's that easy. Get a blood test while you're there.
There's literally websites that you can go to and they send you the STI kits.
Can't get any easier than that.
You can go to the Florida Department. Well, Florida. You can go to any Department of Health, okay? Wherever you're listening from, okay? You can go to any Department of Health and you can go get tested for free.
Yeah. Discreet.
Yeah, it's discreet. They don't need to send the results to anyone. Results go straight to you.
It's better that than a whoopsie situation like she almost encountered, but then it happened to be a false negative. I mean, a false positive.
It's terrible.
Lord.
Totally.
You don't want to catch yourself in something very like dramatic and sticky like that. So just go to one of those websites. And of course, I've said a million times, check out my show notes. I do have a lot of things there from the CDC, from the WHO, from the NIH, a lot of things from the NHS in the UK. If you're from the UK, we do have some UK listeners. So there's so much information out there for syphilis. And because of that, a lot of, like Evie has said, departments of health have resources for it. So check those things out. And thank you for listening. And if you haven't checked out our Patreon, check it out because you're missing out. We're pretty much, I think by the time that this episode comes out, we're 30 episodes deep in Patreon.
That's crazy.
So you could catch up to 30 full episodes like this one, but on whole other topics that you probably have seen clips of in our social medias, you know. And then talking about social media, find us there on TikTok, Instagram, Facebook, Twitter, or X, whatever the hell it's called. Threads. We love you guys from Threads. You guys are phenomenal. You're my favorite. Like Threads, people from Threads have been like
So nice.
so nice. So those of you Thread friends that are listening, hi and thank you.
Hi and thank you.
Yeah. But we'll catch you in the next one, and comment and send us, you know, any other topics you guys would like to hear, or anything like that. Suggestions, ideas, whatever it is. We love hearing from you guys. So catch you in the next one.
Bye.
Like, comment, review us on all streaming platforms, Spotify, Apple Music, Amazon Music, etc.
Check us out on Instagram and TikTok at Funny Medicine Podcast. Our Gmail is funnymedicine305@gmail.com. And remember, we are not diagnosing you.
Definitely not just funny stuff.
See you later, guys.